How do indolent and aggressive lymphomas behave? Imagine two different stories of how lymphoma can grow inside the body. One is slow and steady, while the other is quick and urgent. Understanding these differences helps doctors decide how to treat and manage the disease. Indolent lymphomas are also called low-grade lymphomas. They tend to grow very slowly and often don't cause noticeable symptoms for a long time. Many people with indolent lymphoma find out about it only when it's already advanced because the disease doesn't make them feel sick early on. These lymphomas can stay quiet for years, and sometimes doctors choose to watch and wait rather than start treatment immediately. Although they respond well to therapy initially, they are usually considered incurable with standard treatments. Instead, they tend to come back after treatment, which is called relapse. Over time, indolent lymphomas can change into more aggressive forms, which grow faster and cause more symptoms. A common example of an indolent lymphoma is follicular lymphoma. On the other hand, aggressive lymphomas are also called high-grade lymphomas. They grow very quickly and usually cause symptoms early in the disease. Patients often experience fever, night sweats, weight loss, and rapidly enlarging lymph nodes. Because these lymphomas grow so fast, doctors usually need to start treatment right away after diagnosis. Aggressive lymphomas tend to respond well to chemotherapy and other therapies, and a good number of patients can be cured. However, even after successful treatment, relapses can happen, often within the first 2 years. Examples include diffuse large B-cell lymphoma, mantle cell lymphoma, and Burkitt lymphoma. A key point to understand is that sometimes an indolent lymphoma can transform into an aggressive one. This change happens due to genetic mutations that cause the disease to grow faster and behave more severely. When this transformation occurs, treatment strategies shift to target the aggressive form, which can be life-threatening if not treated promptly. Transformation can happen at any time during the disease course, sometimes early, sometimes years later, and in some cases, both types of lymphoma can exist in the same person. In summary, indolent lymphomas grow slowly, often don't cause symptoms early, and are manageable but usually not curable. They do carry the risk of transforming into more aggressive types. Aggressive lymphomas grow quickly, cause symptoms early, and requiring immediate treatment, with a higher chance of cure but also a risk of early relapse. Understanding these differences helps guide how doctors monitor and treat each patient. Always remember, each case is unique, so talking to a healthcare professional is essential to determine the best plan based on individual circumstances.